being open to doing this teaching for us.
Yeah, I just want to say thank you so much, Rick. I have often told Rick and Jan that I would follow them wherever they go because they are just such amazing teachers and they embody what they're practicing and what they're teaching and have so much wisdom. So I appreciate the opportunity. Thank you, Rick.
Thank you. Thank you. Thank you. And I'm going to slip out and I'll be back. So turning it over to you.
Well, I just want to say thank you, everyone, for being here. I am in private practice in Minneapolis, and I'm trained in the HOCI model, like Rick had said. I also have training in somatic experiencing, EMDR, and I'm certified through the Psychedelic Somatic Institute to offer ketamine and cannabis assisted sessions. And so part of what I'm also creating is a group collective where we're bringing healers of all sorts together to share wisdom and teachings. And in this space, we're starting to introduce some group ketamine sessions as well. So I want to begin our time together with a short poem that I sometimes like to use to open medicine sessions. I'm going to invite you, if it feels all right, to either close your eyes or find a focal point here. And before I start, though, I just want to honor the indigenous traditions that have long held the wisdom that healing through ceremony and non-ordinary states of consciousness is important. This poem is called The Medicine Woman's Prayer, and it's by Cherie Bliss Tisley. I will not rescue you, for you are not powerless. I will not fix you, for you are not broken. I will not heal you, for I see you in your wholeness. I will walk with you through your darkness as you remember your light. And when you're ready, just an invitation to come back into your space and to just reorient to the room that you're in. So this poem reminds us that we already possess the power and the light within ourselves. We are not powerless or broken. We simply lost sight of our wholeness for a while, but it's always there waiting to be remembered once more. And this is how I think about ketamine-assisted psychotherapy. I'll also refer to this as CAP work, not as something that heals someone, but as something that can help create the conditions where people can begin to more deeply access their own inner healer. So right now, to me, it feels like ketamine is having a moment, but we really want to be mindful about how we use this powerful medicine with sessions or how we support clients who are using this powerful medicine. Today, I'm going to be talking about the value of CAP work through the lens of healing our core issues and how these two approaches can work together. I also want to name that there can be a lot of stigma around some of this work, and I'm happy to discuss any of that at the end. And this can often be because of misconceptions or how ketamine has been used outside of a therapeutic context. I really do believe, though, that when it's held in a structured, relational, and clinically grounded way, that it can support meaningful change. So some of the people that we're working with are not lacking in insight. They understand their patterns. They can acknowledge where they are living out of alignment with self, and yet they still feel stuck in shame, fear, disconnection, confusion, repetition, often still living out of old adaptive strategies that they needed to survive in their homes growing up or in the extremes of the core issues. For me, CAP offers a different doorway. It can soften rigid defenses, increase openness, and allow more access to a more authentic sense of self-worth, compassion, and to the functional adult self. But I believe that ketamine is not a standalone intervention. To me, this is such an important piece about the message today that comes across, that CAP work is most meaningful when it's held inside of a relational, trauma-informed, and developmentally informed model. And this is where HOCI is outstanding for this. CAP is not simply about giving someone medicine. It's a structured therapeutic process that includes preparation, the medicine experience itself, and integration afterwards. So in my practice, medicine work builds on what has already been explored through the HOCI model. The intention is to not necessarily uncover new material with CAP work, although that can happen, but to support a more embodied relationship of what's already surfaced through the HOCI model. So briefly, ketamine works differently from traditional antidepressants. So it's fast acting, and it affects glutamate systems and supports neuroplasticity, which may increase the brain's capacity for flexibility and new connections. Ketamine appears to create a neuropathic window that begins within hours after treatment and may last days, with continued effects unfolding for the following week or two. Clinically, this matters because many clients are not just dealing with symptoms, but with more deeply ingrained patterns. So this increased flexibility can help those patterns begin to shift. So I'm in Minnesota, so I love to downhill ski. And so it brought me so much joy when a prescriber had told me that our ingrained patterns, often from childhood, can be like skiing the same path over and over. The tracks get deeply set and hard to change. Now, ketamine can give us fresh powder, creating the conditions to create new pathways. However, it is our work in taking advantage of the fresh snow. Psychologically, ketamine can temporarily soften rigid ways of relating to ourselves. People might be able to access emotions, memories, and unmet needs with less shame and more compassion. It can create space for something new to emerge. So like I had said, there's three different processes in this. So we have prep, the medicine work itself, and integration. So next I'm going to talk about the prep work. And in the prep work, we're really building safety for what might come up in the ketamine sessions. So the way that I approach medicine work with clients is that first we spend time with psychoeducation, which is all through the lens of the HOCI model. Clients either complete a DART assessment or they participate in an intensive. And so by that point, we have a clear understanding of their story, roles in the family that they played, patterns, and historical selves. The medicine then gives us a different way of relating to that material. So this prep stage is critical because I'm building a sense of trust with my clients' historical selves, and my client is focused on moving more into relationship with parts of themselves and their patterns. During the prep phase, I'm also continuously assessing if someone is a good fit for this work. So I would say that this work is something that about a third of my clients are looking for, right? That this isn't something that's for everyone. So my role here is to assess clinical readiness and to look for things like if someone's in a safe environment, how supported and resourced they are, and their capacity to integrate what's going to come up in the medicine work. So after we've spent some time really building the foundation of the prep work, which again is, to me, HOCI is the foundation of what I do in my practice. Everything else is the paint on the walls and the furniture that comes in. And so after we spent some time with really building up that foundation, we move into medicine. So I refer clients to a local nurse practitioner that I work closely with, and she manages the prescribing and completes a full medical history and screening to ensure that ketamine is appropriate. So she's looking for anything that might be in their health history that isn't going to make this a good fit. If they're approved, the ketamine is then prescribed through a local compounding pharmacy, which I have no part in administering or handling the medication. That's something that's between the client and the nurse practitioner. So if it's a green light and we're moving ahead, from there, I typically offer a series of 6 to 8 medicine sessions for clients. And the first few are spaced out every 1 to 2 weeks. So what we're doing here is we're front loading for more neuroplasticity, and then we gradually space sessions out to every 3 to 4 weeks. Again, integration sessions are essential to this process, and they occur within a few days up to a week after the medicine session. And I'll talk more about that shortly. So the day of the medicine session is really important. So clients are asked to limit news consumption and distressing material if possible the day of a session, and ideally the day or two following. I had a client who would only watch cartoons the day before, the day of, and the day after her sessions. So when a client comes in for a medicine session, we start with a brief check-in and we reconnect with the client's intentions. I always invite people to set an intention, but to hold it really lightly, knowing that the medicine might bring forward something else. And I've come to trust that there's a kind of magic in wherever the session goes, and a real brilliance to what unfolds. So there's an idea with ketamine that you might not have the exact session you think you're going to have, but you're going to have what's needed, even if it's not what you expected. So once we've talked about intention setting, we're going to move into creating the space. So set and setting is such an important work of psychedelic work. So I had a client once say to me, I need to build my nest. And I love that language. It captures the intention of creating the space that feels supportive. So in my office, I have, for example, lots of different variations of blankets. So like weighted blankets, light blankets, fuzzy blankets, and clients will sift through kind of what's going to work for them that day. They might even bring a stuffy or comfort objects from home. And once the nest is built, then we move into taking the medicine. Now, the medication is taken in lozenge form, and there's different ways that people can take ketamine. But for what's legal in my state, I can administer, or not administer, excuse me, but a client can take it in my office in lozenge form. Now, if they go to a ketamine clinic, that might look like an IV or an IM. So the lozenge is held in the mouth for about 15 minutes. And this is where it enters the bloodstream through the oral mucosa, which is the tissues in the cheeks, the gums, and under the tongue. The nurse practitioner that I work with generally prescribes Zofran to help with nausea, which can happen because of how ketamine affects our body, awareness and balance. So it can feel a little bit similar to motion sickness. And I will name that this initial part where the client is taking the lozenge can be a little bit uncomfortable. So after the medication has dissolved, then the client lays down for the session with an eye mask. And this helps reduce any external stimulation and allows attention to move inward. Music is also an important part of this experience. And I generally use instrumental music to support inward focus, though occasionally there are special requests. Like I once had a client, they were working through something in the session, and they had said, I really need to hear Let It Go from Frozen. So immediately I got Let It Go playing. And it was fascinating to see how that was integrating into their session. And then the client had told me that after the session, that they were listening to that song more often to kind of help capture those moments that came in. So for the sake of time, I'm not going to go too deeply into dosing, but I will say that the first ketamine session that people have is known as a handshake session. So this is a lower dosage session where we're just introducing people to the experience. When taking a lozenge, people typically begin to feel the effects about 10 to 20 minutes in, and that experience often peaks around 45 minutes and then gradually tapers. So for some clients, we might offer a booster dose partway through the session once we know how they're going to respond. And the goal here is to just simply deepen or extend the experience. And generally, sessions last about 2 hours. So during the session itself, I'm trusting in my client's body-based wisdom and inner healing intelligence to bring forward what is most important for their journey. I'm also checking back in with the intention that we had set as well. So experiences can vary widely. Some people have biographical memories come in, some have strong somatic experiences, others have symbolic or spiritual imagery or a sense of interconnectedness. Others might be more in their wounding or in their grief. And some sessions can feel quiet or subtle, and all of these are meaningful. So I view my role here as holding the space. In all medicine sessions, there are times when I'm offering periods of silence for them to go inward, and I often reflect to clients what they're naming and experiencing. I'm also tracking what's happening in their nervous system, as sometimes people might go into a freeze or collapse response. I might then gently offer prompts to help their system and to orient them back. With prior consent, which by the way, I just want to name that I have a hefty amount of paperwork that I have people and consent forms that I have people do. But with prior consent, I may even hold a client's hand or offer support on their feet, especially as they're walking through challenging parts of their stories. In this process, I get to witness people reconnect with parts of themselves in deeply meaningful ways. Some clients choose to record their sessions, which I strongly encourage, and I'm always taking notes to reflect back the wise inner knowings that are coming through. Again, to me, it feels like in these sessions, people are really anchoring in more to their functional adult self. These sessions can soften the grip on old stories and can show people what life can be like without anxiety, fear, and shame. It's important to note, though, that there's not a quick fix. So while ketamine generally offers initial symptom relief, um, we can't expect this medicine to only do something for us. However, it can work with us, meaning that we can go on a journey, but we have to be an active participant with this medicine. So this work really needs to be done with intention. So the final piece of this is integration. And like I had mentioned, after each medicine session, I meet with clients within a few days, up to a week for integration. And integration is also crucial to this process because it's about deepening into and helping land what came up for people during the session and exploring any new awarenesses that emerged. So integration can be an overlooked part of this experience. Now, during this time, clients are in their recovery window. Again, where there's more of that neuroplasticity, where there's continued effects for, again, a few hours after treatment, up to a few days, which can unfold for 1 to 2 weeks after. And so during that period, our brains are like fertile ground. And we're more open and impressionable, and we have more flexibility. So it's important during this time to capture what came up, whether through journaling or tracking internal experiences. I encourage clients to take voice notes and to really be reflecting their own internal experience. And this insight can help bring things into real change. I also encourage people to find a creative outlet during this time. So that might look like a dance class or painting, whatever it might be. There can be a messy middle part here, though, that we can't skip. So for some people, shifts after the medicine sessions might be something subtle, like noticing their mind was quieter or having an experience of being with themselves with less background noise. And I've heard clients reporting feeling less reactive and more able to respond to life from a centered place. So I think about this as people going from fast pitch to slow pitch. So one of the most meaningful aspects of this work for me is seeing people be able to have more spaciousness in their system and with themselves. Clients often develop a deeper connection and understanding of their historical selves, while also gaining more access to their functional adult self. The loyalty binds that we can find ourselves in sometimes when we're working with developmental trauma also seem to soften with medicine on board. There tends to be less judgment of self and others and more of a settling into a deeper knowing. The part of our clients that might even feel like they need to perform or hustle for value, even in our offices, often fall away. This deeper knowing often shows up in core issue 1, where there is a greater access to a sense of inherent worth. I've seen with clients that the medicine can support a deeper knowing of their own value, as well as the value of others. And it can also help people feel more grounded in their reality. And from there, they're often better able to step in to boundaries that they want to set and care for themselves in more intentional ways. I've also seen growth in moderation, where people have more balance in self-expression and healthier limits within themselves. And I've observed meaningful shifts around attachment, especially where there has been emotional neglect, with people finding more balance in their relationships. At the same time, for some clients, there can be an increase in activation from historical parts and moments of vulnerability where they feel closer to their wounds. Much like an intensive or other HOCI processes, these periods of tenderness can be an important part of the healing process. It can really bring us in touch with that grief too. So in that, there can also be a clearing where we're making space for more peace within the system. So there's still so much to learn about this medicine, but part of what I want to continue to explore is what maintenance looks like. So in my own journey, I took a few years between ketamine treatments, but have returned to ketamine as needed. For some people, this might look like a quarterly session or a few sessions clustered together at certain points in time. And some folks that I'm working with at this point, they've had years from the time of a medicine session and don't feel the need to return to it anytime soon, which is great too. Next, I'll share a few stories. And the idea of sharing these stories is to bring together the prep, the medicine, and the integration through the lens of HOCI and CAP work. So I asked a few clients for some feedback, and I was granted permission to share some of what they had to say. So one of my clients wrote, the process I followed began with completing the DART assessment and then spending months doing prep. This was one of the most challenging things I've ever done. I had very few memories of my childhood and a lot of fear about what I might uncover. At times, the work felt overwhelming, and I realized I wasn't just talking about my story, I was reliving it. Learning to witness those experiences through therapy instead of being consumed by them was new and difficult. There were places I avoided because I was afraid of the darkness. By the time I began the medicine sessions, I was scared, but I trusted the process and the relationship that we had built. That trust made it possible for me to go into places I had avoided for years. The first session was intense. I was falling through darkness for a very long time. I'm not sure if I was screaming out loud. I sure was in my head. I remember Alissa taking hold of my feet to help me ground. And that was part of what gave me strength to keep going versus pulling the ripcord and trying to stop the visions I was having. Once I made it through the darkness, I started seeing colors and shadows of things around me. I shared what I saw and found out that I didn't disappear or get consumed in the darkness, and that there was a path forward for me. One I could get through and understand what the darkness was about, and more importantly, what was on the other side. As sessions progressed, I was aware that my inner child had felt that everything was my fault and that the only way to get any attention was to act out, shoplift, run away, fight with my brother. Here was the source of my inner bully, convincing me that everything was my fault, and the only thing I could do was to act out to get attention. With this realization, I began to understand the pattern in my life that I hadn't before. It is a pattern that I had seen pieces of, I just hadn't put the full picture together. With each session, I got through the fear and the darkness faster, and I could start looking at my inner thoughts and higher self. Each session opened up more knowledge that I didn't have or I had heard about in talk therapy, but it would never stick. It was sticking now since I was experiencing and understanding what I was thinking and feeling. The medicine helped me fully embrace the new knowledge in my core. In talk therapy, my risk manager would work to keep me safe and not go too deep, as well as my codependents would have me saying things to be seen as a good client versus what I truly believed. The medicine took all this away and let me be my true self and allowed me to look into places historically I was afraid of. By my 7th session, I experienced something I'd never felt before, a sense of balance. I could hold happiness and sadness at the same time. I've made more progress in these past few months than I did in years of talk therapy. This work hasn't always been easy, but it's been deeply meaningful. And what made it possible was not just the medicine, but the relationship and feeling safe enough to go deeper. And so I just want to name what that client is saying at the end is that this idea of feeling the safety and the feeling of going deeper, that was in large part because of this prep work that we had done with the HOCI model and then how we had wove that into the CAP work. So another client had shared, and I had done an intensive with this client. So they had shared, the intensive helped me understand my reality. With my story, confusion has been very present, and I felt like the intensive helped me decipher patterns, themes, and the overall picture of my childhood, which I had not been aware of prior. Through CAP, I was able to develop a strong sense of body-based wisdom and what it feels like to be in my body. The intensive and the medicine really complemented each other. It felt like another way of working with the same core issues, just from a different entry point. So I just have another moment here, but before I do, I'm just going to invite us to wiggle our fingers and our toes as we're here, bring a little movement. So lastly, I'd like to share a bit of my own story. So in a similar way to when I was presented with HOCI, I knew that I had to have that, and I wanted it for myself, and then I wanted it to be able to offer to clients. I felt the same way with ketamine work, was that in my own ketamine sessions, I found it to be really powerful and felt called to bring it into my work with others. So, one of the core themes of my life has been learning to trust my own reality. And for a long time, I struggled to fully believe what I knew to be true. So, during my first ketamine story or session, my story unfolded in front of me. And instead of doubting my reality, which had been my habitual pattern, I was able to hold it with a deep sense of knowing, not just cognitively, but in my body and in my heart. I believe myself fully. Ketamine gave me the experience of not only knowing my reality, but believing my reality. Something had shifted, not because I learned something new, because I already knew these things through my work in HOCI, but because I was finally able to believe something deeper. So, from that place of better knowing my reality, I was able to stand more fully in my inherent worth rather than shrinking or people pleasing. I also experienced a stronger connection to my functional adult self. For me, it felt like a deeply spiritual experience, like accessing a higher part of me. Even my spouse noticed a difference in me, noting that I seemed a lot more present and able to keep the worries of life more at bay. And at the same time, again, I want to name that I don't think that there isn't a magic solution. That HOCI and CAP gave me the gift of seeing the truth. And I do believe that part of my life's work is continuing to tend to the confusion, doubt, and disconnection that impacted how I moved through the world. What I've come to see is that once you've had a glimpse of something different, which is what both of these models gave me, it became easier to find your way back to it. But it's my work to find my way back. I truly feel privileged to sit in these spaces with people. Both the HOCI and CAP models invite people to go deeper, to explore the many facets of self, and to begin shifting out of living from wounded and survival parts into embodying our true nature. And for me, I would never do CAP work without the foundation of HOCI. And for the right people, which again isn't going to be for everyone, I do believe that CAP can help deepen into the wisdom of the HOCI work. Ketamine is here to show us what's possible, not to fix us. So I just want to say thank you all for being here. And hopefully this has given a clear sense of CAP work and how these models can go together.
Thanks, Alyssa. Wow. I missed the first few minutes and then I was able to hear the rest. So uh thank you, thank you, thank you. And again, knowing you over this last 6 years. So did you start in this journey after we started together and
Yep. So it was about I came to CAP work about a year after coming to
okay,
HOCI.
okay. I wasn't sure. I thought so, but I wasn't exactly sure. And I love how you weave that through. And obviously this is not for everybody, but like Susie said, that it is something you see all the time. And um, so that I just want to open it up for about a couple of questions and sparking interest. And Alyssa, use your boundary. Would it be okay if people wanted to reach out to you?
Yeah, absolutely.
Okay. Um, that maybe you could put your email in the um, chat if anybody would want to reach out to Alyssa. Again, just knowing Alyssa over this last 6 years is that what you're seeing here is just a woman of depth who is passionate to help people with healing and this is an incredible space for some people. But her work, I was telling her earlier, two of the women who went through the intensives who are in the training this week and just talked about how transformative it was. So um, any questions, any thoughts, comments? Again, we just have those 5 minutes, but oh, Beth.
Hello. I put my hand up a long time ago, Rick.
Oh,
Just kidding.
sorry. I was
No, I don't know, Alyssa. Maybe we went through that level one training online in 2020 at the same time. You look familiar to
So
me.
do you, Beth. We were in a small group together.
That's why. Oh my gosh. Yes. Okay. I love it. All right. Question. I mean, I have so many and I jotted some on the sidelines, but um, what would you say is something that would absolutely preclude someone from doing the treatment? Or what do you flag as like, yeah, not a good fit?
So any history of mania, psychosis, any type of underlying heart issues, and also if someone's in any type of an abusive relationship, kind of what are they going home to? Because during this time where people are doing these treatments, they need some extra support around them.
Okay, cool. Thank you.
Beth, were you in that June of 20, the very first group?
I think so. And we did, I mean, like we were waiting to do level 3 until we could finally get back together in person.
Mhm.
Yeah.
I will note that now. I didn't remember you being in that very first group. So, okay. And Alyssa, you remember you guys were in level 1 small group together?
Yes, I couldn't recall if it was level 1 or level 2, but I totally trust that was level 1.
Yeah, I believe it. I mean, like I believe like when you mention that, I'm like, oh yes,
Yep.
for sure.
Yeah.
Mhm.
And I will just say that that's part of because a couple of you are are newer to our work and everything is we do try to this is part of having a community, different things. And Jan and Blake, some of you know Blake, are working on a kind of like with your professor having office hours that there will be opportunities for people just to do consultation, come in, talk about things. And so a lot of exciting things coming that we'll be talking more about in this meeting. But uh, that was a really important question, Beth. Thank you. And I
Looks
did
like
raise
Susie has,
my hand.
looks like
Anyone
Susie has
else?
a question.
I'm sorry, Alyssa, what'd you say?
Oh, looks like Susie has a question.
Oh, Susie.
Yeah, so I actually have two questions, Alyssa, and your presentation was fabulous. Thank you very, very much. You covered so much ground so efficiently. Um, Question number one, so I do know here in Florida a couple of people who are using this modality in their practices who I would not recommend to a client, to a former client or a friend of mine. Is there any particular training for doing the CAP work that you would recommend a person look for in a practitioner?
So
Mm,
that's a great question. And I know Ari had mentioned breath work. Whenever we're working in altered states of consciousness, we really want to be doing this mindfully, right? And so I do think that, like for me, my training was through the Psychedelic Somatic Institute, which is based out of Colorado, and they did a really great job of everyone who went through that program had to be going through and walking through the model themselves. There was a lot of experiential pieces to it, and it was a lengthy program. So I would be skeptical of people where they're going and they're doing a weekend training for this. I do think that, and that you can find out, right? Like based on what people's backgrounds are. Does that answer that?
Yes, that absolutely answers that question. I can't see if other people have their hands up. Can I ask another question?
I
I think you're good.
think we're good. So we'll take this final question, Susie. Great.
Thank you. So the other question is, I've had this conversation with someone who has been through multiple 12-step programs.
Mm,
They have a very specific challenge around, like, for example, he won't participate in 12-step meetings where everybody's smoking outside afterwards and you have to walk through a cloud to get out because he feels, because he's been through multiple 12-step programs, that this is just people switching their addiction from one thing to the next to the next. And his concern with ketamine treatment is the same, that it can become a different form of addiction, and also it's an expectation that something outside of yourself is doing the work with you.
Yeah, and again, for me, that's what's so important around. I'm not using ketamine as something that's going to fix me. I'm doing it as an aid to help kind of pull back a little bit so that I can look at some of this subconscious material. And so what I found with people is people actually report feeling like drinking less, for example, or where there's less desire to go to that old coping strategy because there's less need for it. One of the things, and I didn't include this, my client wrote a lengthy piece, and one of the things that he had said is that he doesn't have any concern about having any addiction with this or any pull towards that because it's not, when you're using it in a therapeutic context, that's just what it becomes, right? This isn't a medication that I want to use outside of this space. It becomes something sacred in this particular space. So to me, research is still coming out about this, but overall, I actually think that this could be something that could be helpful with addiction if used in the right way.
Thank you very much, Alissa. I appreciate you.
Mm-hmm. Thank you to everybody. I agree, Beth. Really, thank you, Alissa. So we're going to be back next month. I usually try to look if I'm the host here on the date, but it's the 4th. We always do the 4th. So if there's 5 in a month. So the 4th Wednesday of, which is, again, hard to believe here that we're coming to the end of this month, but of May. So everybody have a wonderful afternoon. Thank you for coming. Thank you again, Alissa. And do reach out if you have any questions. That's why I said use your boundary. I thought I knew what you would say. But everybody have a good afternoon, okay? Thank you.
Thank you.
Thank you.
Thank you.
Thank you.